How do epilepsy driving restrictions work? Driving restrictions for individuals with epilepsy are essential for ensuring safety on the roads while allowing for personal independence. The main idea is that a person must be seizure-free for a certain period before being allowed to drive. Typically, this period is at least 3 months, but it can be longer based on individual circumstances assessed by a medical advisory board. This board looks at a person's seizure history, types of seizures, how well they follow their treatment plan, and other health factors to determine if they can drive safely. One of the key components of these driving restrictions is the seizure-free interval. Most regulations requiring that a person must not have any seizures for at least 3 months before they can legally drive. This rule applies to both new drivers and those who want to resume driving after experiencing a seizure. However, the length of this interval can vary depending on the person's specific situation and the likelihood of having another seizure. Another important aspect is the individualized risk assessment. A medical advisory board, which often includes neurologists and epilepsy specialists, conducts a thorough evaluation. They consider the type of seizures a person has, any known triggers, their medication status, and how well their seizures are controlled. This personalized approach acknowledges that epilepsy is different for everyone, and some individuals may be able to drive safely sooner than others. Medication management is also crucial. Individuals should refrain from driving during any changes in their epilepsy medication, such as when they are tapering off or stopping a medication. These changes can increase the risk of seizures, making it unsafe to drive. When it comes to medical reporting, healthcare providers have the option to report individuals who may pose a high risk to driving authorities. However, mandatory reporting is generally discouraged. This is because it could lead people to hide their seizures or drive without a license. Ultimately, the decision to grant or restrict a driver's license is made by governmental regulatory bodies, not by healthcare professionals. There are exceptions for people who experience seizures triggered by temporary factors, like a high fever from an infection. In these cases, they may not need to wait for a seizure-free interval before resuming driving, as long as the triggering factor is unlikely to happen again. From a safety and public health perspective, while individuals with epilepsy do have a slightly higher risk of motor vehicle accidents compared to the general population, studies indicate that, with proper seizure control and personalized assessments, the risk of seizure-related accidents is very low. In fact, the risk of fatal accidents for people with epilepsy is not higher than that of the general population and is significantly lower than the risks associated with alcohol consumption or distracted driving. For those whose driving privileges are limited, it is important for government agencies to provide alternative transportation options. This helps maintain independence and quality of life for individuals with epilepsy. In summary, epilepsy driving restrictions are designed to ensure safety through a combination of seizure-free waiting periods, personalized medical evaluations, careful medication management, and regulatory oversight. These guidelines reflected current medical consensus and emphasize that most individuals with well-controlled epilepsy can drive safely.